Hello, this is Dr. Lara Tigler. Welcome to my channel. This channel is meant to provide good general medical information. It is not meant to provide specific medical advice. Please do see your primary care provider or doctor to obtain medical advice that's tailored specifically for your needs. At the end of the medical information, I will give some spiritual information. If you do not want to stay for that portion of the video, once the medical information portion is finished, I will let you know, and at that point you can simply click away. But first, please do like and subscribe. One of my motivations for starting this channel was that I am a senior specialist for several years, and prior to that, I was a primary care physician for 21 years. And as you can imagine, throughout the course of the day, I'll be repeating myself. And with the advent of this technology, YouTube and other platforms, it's a really nice way to say the information that I give to the patient and have it be recorded and then reach more people. So please do share this with your family and friends if there's a specific chronic disease that they suffer from. And it could be a good starting point for them to learn about the condition. I view this channel as a podcast, but as my viewers know, I am slowly adding some visuals. But I do work and I have a family with small children. So as you can imagine, I don't have time to fine tune the videos as some full-time YouTubers do. But today I do have a bit of visual aid for you. So this topic today is going to focus on the cardiac cycle and myocardial infarction and how it looks on an EKG. Really, it's good information, but it's really just preparation. I had in my mind when I've been seeing patients through the many decades that oftentimes there are some non-specific changes on their EKG. Remember, I'm a senior specialist, so I only see patients age 65 and older. And very often I'm working with a cardiologist. We work as a team to take care of the patient. And there is a myriad of findings that can be found on the EKG. And many of them don't have clinical significance. But I'm explaining again and again some of these minor findings or not clinically significant findings. And I had a vision that it would be so nice to give a video on some of these not so important findings, and that can take some anxiety off some people's shoulders when they do hear from their doctor that it's not completely normal. But in order to get that video done, I have to do this video. And this video is just going to focus on the cardiac cycle, which is your heartbeat. Lub dub, lub dub, lub dub, bum bum, bum bum, bum bum. So there's a whole bunch of information that goes into that heartbeat. We're going to touch on it a little bit. And then I did do a heart attack, myocardial infarction, acute coronary syndrome video a while back. And you can go back and reference that and see that again. So you can kind of put everything together. The pieces of the puzzle will be put together and you should see a whole picture and feel better about your heart. Okay, so I am going to go ahead and try to share just the basic anatomy of the heart. Okay, so we are sharing, and this is just 3 different views of the exact same heart because I wanted to show you the cycle. I'm not going to show you a circle, the cardiac cycle. I'm going to show you it in 3 phases, which is also commonly how it's taught. So this first pictogram or picture, it says cardiac diastole. So that's when the entire heart relaxes, and it's very short in duration. So the heart is not putting blood into your body like a faucet. So you turn the faucet on, and there's a continual stream of water in your house or your sink. Instead, how our heart works is it pumps the blood in a cycle. So there's a brief moment where these chambers, these up here are the atria. This is an atrium. This is an atrium. So there's 2 atria. And on this side, this is the left portion of the person's body. So if the body is attached to this heart, we're actually looking at the person's face. So on this side here, this is the left side. And you can just kind of look, if you're looking yourself and investigating, see how thick this muscle is right here. So this is a very important ventricle. It pumps the blood to your entire body, the clean blood, the blood that has the oxygen. And this side here, and this pictogram does it in the color blue, just to let you know that the blood here is coming back from your body. So it doesn't have as much oxygen, but it does have a lot of carbon dioxide. And so it's blue. Okay, so in diastole, cardiac means heart. Diastole means it relaxes. All four chambers, these top two atria, and these bottom ventricles are relaxed. So blood is just flowing. It's going through these doorways here. We call this a valve. There's a valve here or a doorway. Think of it like double doors going into a master bedroom. Here are the double doors here, and here are the double doors here. So there's four different important valves, or you could in your mind just think doors. Okay, let's go to the second phase of the heart. So this is the atrial systole. So I mentioned in one or more videos in the past that the atrium, they're responsible for about 10% of the blood that's pumped out into your body. You could think of it like an atrial kick, a helper from the back end. Okay, so when the atrium contract, the blood is going from the chamber, the atrium, into the ventricle. And you can see it up here on the left. The blood's shooting through the open doors, which is the double doors to the master bedroom or the valves, and it's going in to the ventricle. So the atria contract. At the same time, the ventricles are in diastole. They're still relaxed. They're not actively pushing the blood out, in the case of the left ventricle, out into the body yet. They're allowing the blood to come in. And this third phase here, the atrial diastole, so that's where the atrium, they're both relaxed. They're not pushing anything. But the ventricles, the ventricle systole, they're actively pushing the blood out to their respective areas. So the right ventricle is pushing the blood back into the lungs to pick up some oxygen. And the left ventricle is pushing the blood into this major artery right here, the aorta. And so these three arteries coming off the aorta, they're going to be delivering blood upward in the body. And then this arch going downward here, descending, that's going to deliver the clean blood to the lower part of the body and all of the vital organs below the heart. Okay, so now that's a helpful picture of the three phases. So I'm going to stop sharing for a moment. Okay, and then I wanted to show you the heartbeat. Okay, so we're going to go over this portion here. These bumps are seen on the EKG, the electrocardiogram. Let me get rid of that light for you. There you go. So this is the main beating of the heart, one major beat. And there'll be about anywhere from a few to several heartbeats on an EKG. The EKG lasts 60 seconds. So we might have one heartbeat per second. We might have 60 beats on the EKG. All right, so this here says atria, and it says depolarizes. So right after the atria, those top two chambers I showed you depolarize, and we'll go over the what happens at the cellular level, at the cell, the myocardial cell in another video. But the electricity changes in the cell. And right after the atria depolarize, then the atria contract. And that's when I showed you that the blood is going into the ventricle. Okay, this portion here, and this is called a P wave, by the way. and the atria depolarize. And then this portion here, this up and down spike, it's so big compared to the P, but the up and down spike is when the ventricles depolarize. And that's just because the ventricles, even though you couldn't see it too well on the picture that I showed you, they really are so much larger than the atria. And that's why their spike or curve on the EKG is going to be larger. And then right after the ventricles depolarize, that's when the ventricles contract. And then this here is called a T wave. It's upright. And it represents when the ventricles repolarize. So they have to reset themselves to get ready for the very next heartbeat. And this is where they do it, the ventricles. The atria, they repolarize too, but because they're so small compared to the ventricles, it's just lost in this huge QRS complex. You can just think of it as the spike. So there's a wave, the spike, and then there's another wave. But please do look it up. So it's PQRST. And so those are the letters, kind of like a piano, A, B, C, D, E, F, G. We just use the 7 letters for the piano over and over again. We're using the PQRST over and over again in the EKG. But anyway, the T wave is when the ventricles repolarize, get ready to beat again. When the ventricles depolarize right up here with the spike, I actually wrote down here causing contraction. So if you are going to look at this, this arrow goes up and it causes contraction. And I should have done that for the atria as well. The atria depolarize, and that causes the contraction of the atrium. Okay, so now that's some basics for the cardiac cycle. I'm going to show this picture over here. I drew this for you guys. Okay, so say this is just part of the ventricle wall. And don't think of it as a blood vessel. I know I have white space in there, but this is just a wall. Okay. And then this is just representing a normal wall and a normal EKG reading for that particular beat. I did put blue little dots at the base just to show you that these beats are going to proceed and have a baseline. And it's always going to be in line. So you've got the PQRS complex and the T wave, and that's just all normal. Okay, now this is an example of a myocardial infarction. I am not going to be showing you the long list of possible findings on an EKG. We're going to do that on another video, but I think people are always curious about myocardial infarction. So when ischemia occurs, so there's a blood vessel that is in charge of feeding the heart muscle, and somehow it got blocked. It had a sudden reduction in blood flow. And so ischemia means that there's a sudden reduction in blood flow. And on the EKG, see that blue dot line? There's still an obvious baseline, but this T wave that was pointed upward in the normal EKG is now pointed downward, T wave. So a T wave like that can show ischemia. Okay, then we progress. Let's say this injury or sudden reduction in blood flow is allowed to progress. And so there can be an ischemia zone, and then that develops into an injury. So it's just progressing. And you see how in marker, I just put it more solid. There's a zone where it's just not getting any blood flow really at all. It's beginning to die. Okay, so the P wave is the same. But notice how this portion, this spike here, this last portion, QRS, the downward aspect of this QRS or this spike, we call it S. And then remember that wave way at the top, we called it T. So this between the S and the T wave is beginning to elevate. And that's my little blue arrow up and down. It just means it's above the baseline. Now, if someone's an injury, that might be 1 millimeter. If we reverse the problem that's occurring and make sure that there's blood flow to the muscle in the heart, then that could just go back to baseline and the patient will be fine. But let's say this condition, this sudden reduction in blood flow persists, then what's going to happen is that that same wall, this area here, there's a specific area that actually died. We call that infarction. And we can't get that back. And at that point, see how there's a big elevation? This was kind of small, but now this blue line that I wrote is way above the blue dots. So the ST elevation is just so high up there. So that person's had an acute ST elevation myocardial infarction, which we abbreviate STEMI, STEMI. And you'll notice that because it's infarcted, that spike in the middle, usually there's no Q wave coming down. We call it QRS, but there usually is no downward spike. And then because that part of the heart muscle got basically infarcted, it's reflected in this spike coming downward. And that has to do with this loss of this part of the heart not generating any electricity. And remember, the EKG is an electrical representation of your heartbeat. So this spike coming down, we call that Q. Okay, so I wanted to give you an idea of the cardiac cycle, so that, and then how the blood flow to the heart relates to the EKG, that QRS complex, PQRST. And you can look all of this up. I encourage you to read, type it in, and try to put 2 and 2 together. Hopefully with the videos I'm giving you over time, you're going to actually see the picture, the whole picture, and everything will become simpler to you. I do want you to get into some of the nitty gritty. I think that it's important if you are a senior, if you're age 65 and above, and you have a family history of cardiovascular disease, or you have strong risk factors such as having been or currently a smoker, having diabetes mellitus type 2, or even prediabetes, and many other risk factors, which we talked about in prior videos. I think it's important to educate yourself, and I do want you to consider asking your doctor about the EKG that she generates for you. It's not really enough, in my opinion, just for the provider to say it's normal. You really should go over the EKG and analyze it, and understand your heart electrically, and what that means for the anatomy of your heart, and what the risks are, what your other conditions are predisposing you for, so that you make a smarter decision about which medicine you take or don't take, which lifestyle you choose or don't choose, because everything that you choose affects your heart. So I do want you to be aware of that. Okay, so hopefully I will do a subsequent video on a list of abnormalities for the EKG that aren't too important clinically, but do give the patient some pause. And that will be helpful, that if you could learn that, so you can know what's important and what's not important. This is the end of the medical information. If you do not want to stay for the spiritual information, then this is the time to click away. But first, please do like and subscribe. Please support the channel. Okay, so for the spiritual information, I'm going to go over a few books. The number one important book, in my humble opinion, is the Bible. It may be accurate, it may not be accurate, it may be confusing, it may have a lot of conflictual information, but that's where Bible study is so important. And then, as you may imagine, I am very well read, and I also have some wonderful YouTubers that I follow that are theologians. I've written a theological book myself. So I do think it's a good idea to expand yourself beyond the Bible. But that's a huge area. So let's go to the next logical step. So we have the chapters or books in the Bible. So we Christians and other religious folk call it books, even though the Bible is a book. Okay, so the Bible has so many books, depending if you're a Catholic or a Protestant. or so many books, depending if you're a Christian or a Jewish person or from Israel. Um, I do like one particular YouTuber, Matt Baker. The name of his channel is Useful Charts, and he goes into much detail on the origin of the books in the Bible, when they were written, a lot of history, and he does it very well with a graphic representation. There are many other YouTube channels that are wonderful, that are helpful. Within Reason is a good channel where actually it's an atheist, or he used to be an atheist, and he interviews many theologians and goes over philosophy, classical philosophy, Aristotle, Plato. Very, very important to read Aristotle, Plato, in my opinion. And then just recently, I've had two books that I just finished. I just finished this book, The Lost Pillars of Enoch. Now, Enoch is one of those books that's part of the Apocrypha. It's just a fancy name for a book in the Bible that wasn't included in the final version. But it's always been part of the canon in the Ethiopian church. So it's really not correct to say that it's fully apocryphal. It is a bona fide book in the Bible on a continuous basis for hundreds of years with the Ethiopian church. So this is a great read. I recommend that. And then I'm currently reading All Things, All Things Are Full of Gods. And he did say he had trouble finding a title. And this is a quote from Thales of Miletus, I believe. He's a Greek philosopher from about the 600 to 800 BCE. But I think I'm in the middle of this, and I think it's very good. He's a theologian and a philosopher. So you can learn a lot about your particular religion and other people's religions by reading other books, whether they're written by a theologian or a philosopher, or whether they're actually an analysis, in the case of the Enoch book, of an apocryphal, kind of apocryphal book. And then last but not least, I've written a couple books, and they both are spiritual. So this was written in a stage of my life when I gained my salvation. And I do think it's excellently written. I know that I wrote it, and patting myself on the back, but I think it's excellently written, and so I think that you'll enjoy it. No matter what stage you are spiritually, even if you're quite advanced, you might still enjoy the somewhat autobiographical, exciting story, or even sometimes those of us who are very well read or devout religiously. For example, I'm a devout Christian. We might appreciate learning and hearing about another person's spiritual journey. It gives us reflection on our own journey. So I do recommend that book, and you can buy that on Amazon.com. And then the second book I wrote was purely fiction. I wrote it for enjoyment and to pour out my creativity. So in my mind, it's purely a creative work. It's good for adults. I didn't write it for kids. And I think of it like a bedtime story for an adult, or if you're on vacation. And then in this book, what's unique about it is it's an adventure mystery thriller, and the hero is a woman of faith. You don't often see that. And then also, it's half Christianity, half Hinduism. I'm not sure how often you see that either, where Christianity and Hinduism are so easily intertwined into a spiritual story in the context of a mystery thriller. So I do think this is somewhat unique, and you might enjoy that. So that's the end of this video is book recommendations. I encourage you to read not only medical. I would say, this is my personal opinion, but I would say please stay away from TV. You have so much other things you can do to make yourself healthy, spiritually and physically, that when you watch TV, it's taking up some valuable time. So, but that's the end of this video. Thank you so much for watching, and I will see you next time.